bonsoir. Welcome, everyone. It's great to see you out this evening. My name is Carrie Schubert-Mackey, and as Director of Community Health at the Timiskaming Health Unit, it's a privilege to be here with you this evening. We want to get things started with a brief background as to why we've collected here this evening to weed out the facts and discuss youth marijuana use. In 2015, the Government of Canada committed to introducing legislation to legalize, strictly regulate, and restrict access to cannabis, also known as marijuana. The Federal Cannabis Act is now before Senate and progressing through final stages. The Government of Canada originally had slated this July as a timeline for full legalization, but it's being suggested that the date is now a bit of a moving target. So while this work has been happening at the federal level, the provincial governments have also been preparing their side of laws, regulations, and actions to support the broader cannabis legalization framework. In Ontario, this means a public health approach to protect and educate youth, maximize public health and road safety, and reduce harms. Ontario's new laws are about how, where, and who can buy, possess, and consume cannabis in the province. These rules are similar to those in place for alcohol and tobacco, with some differences. You will need to be 19 and older to buy, use, possess, and grow cannabis for non-medicinal use. And it can't be used in public or at work. And pretty much the only place that's legal to use this is in your home or private residences. Marijuana is one of many psychoactive substances that has been used for a variety of reasons for a very, very long time. And so it's been talked about and discussed frequently over time. And sometimes the information shared in conversations influences our perceptions. But the information is not always accurate, and things change. Just like technology changes over time, and what's cool and trending to do on a Saturday night changes over time, the age at which youth may experiment with substances changes, and the forms and potency of substances also changes over time. So it's important to have ongoing dialogue and to have education and stay up on things. And with the process to legalize cannabis, we've already seen more government funding being provided for education and awareness. And it's really opened the door to even more dialogue on the topic of cannabis use and harm reduction. In fact, many education and awareness campaigns are now rolling out, including from our Ontario Ministry of Education school partners, who along with School Mental Health Assist and the Centre for Addiction and Mental Health are developing some really great material. So with that, we thought it was timely to add to the discussions in our communities and help weed out the facts. The topic can elicit a range of feelings and emotions, and frankly, it can be hard to sort out the facts and figure out how to talk about it, not to mention figure out what is best. And when it comes to our children, figuring this out really matters. It matters a lot. So let's get started. I'd like to introduce Amanda Mojo, a program manager with the Timiskaming Health Unit, who along with very dedicated and skilled public health promoters did a fantastic job to make this evening happen. Amanda's going to be our moderator for the evening, and she'll do some quick housekeeping notes, and we'll also introduce the panelists, who we are very grateful to for helping us weed out the facts. So over to you, Amanda. As soon as you get your mic.
This mic. We may not need a mic that much, except for our online viewers. Thank you, Carrie. Welcome, everybody. Welcome to our discussion. I'm joined tonight by three very experienced and knowledgeable people from our community. Dr. Glenn Corneal is the acting medical officer of health for Timiskaming, and he's going to be speaking tonight both from a public health perspective, but also from that of a frontline doctor who works in emergency and has a family medicine practice. So welcome, Dr. Corneal. To his left is Dr. Bob King. Dr. King is a consulting psychiatrist with our local branch of Canadian Mental Health Association. Some of you may know him already, and multiple community living agencies in the north, even in northwestern Ontario. He's been instrumental in developing a number of regional programs for people with intellectual disabilities, autism spectrum disorders, fetal alcohol spectrum disorders, and mental health concerns throughout Northern Ontario. Welcome, Dr. King. To his left is Crystal Oviatt, who is a public health promoter with the Timiskaming Health Unit with a number of years' experience. She sits on the Timiskaming Road Safety Coalition and is also highly knowledgeable on the topic of developmental assets. She's going to help us talk today about how we work with our youth, how we talk to them about this topic, and ways that we can work as a community to support and prevent any harms from cannabis use among youth. So welcome, everybody. I'm very excited you're here. Tonight's event is being live cast on Facebook. So this is a new experiment for us, and so we thank everybody for being willing to be part of it, and we welcome all our viewers. It's also going to be recorded so that if people weren't able to join us in person tonight, they can view it again. So you can tell all your friends about it, and then they can watch the recording. So we're really excited. So let's get started. We're going to be talking about youth cannabis use tonight, as we all know. As Carrie mentioned, although new developments may be coming around legalization of non-medicinal cannabis use for adults or medical cannabis use we're already seeing, the topic at hand tonight is youth cannabis use, which may not really be affected too much by those things. And so we really are hoping to keep the conversation focused to youth use and not go down the garden path too much around those other topics. And when we talk about cannabis, we're going to talk about weed, marijuana, pot, and all these other things that we can call it. And just to keep us focused, that's the dried flower buds and leaves of the cannabis plant. So that's our definition. We're going to have a discussion to start things off. I have a few questions I'm going to ask our panelists, and then we're going to open the floor and invite any of you to ask questions. I'm going to be monitoring our live feed, so people watching on Facebook, if you have questions, type them in, and we'll do our best to get them answered as well. So let's begin. Why don't we start with Dr. Corneal? So we often hear that among youth and cannabis, everyone's doing it. I think teens tell us that. We feel that that's the case. Is everybody doing it? Is that true?
Well, thank you, first of all, for hosting tonight, and it's a pleasure to be here. The quick and easy answer to that question is no, absolutely. The majority of youth are not using, but there are a concerning number, and it's going to be a good discussion tonight. One of the things we know is that there's some data that I'm going to start. I get to do the data stuff to get started. So World Health Organization data shows that Canada is one of the highest countries for youth cannabis use, around 13% across the country. We also know that for Ontario data, we talk about 20% of students between the ages of 15 to 19 have used within the last year. And that number does go up to about 30% in the 20 to 24 age group. So while it's not everybody, there's still a significant number of students who are using.
Okay, and what about, is that changing over time? Is it going up? Is it going down?
You've thrown me a little bit of a loop there, sorry. That's okay. How about I talk about local numbers first?
Sure.
That's what I had in my head. So one of the things, just starting with Canada, Ontario, Timiskaming district, because of the size of our district, there haven't been a lot of local studies. But we know from the small studies that have been done that our numbers are similar to Ontario numbers and similar to Canadian numbers, so we can extrapolate that. So just with respect to local numbers, between the ages of 12 and 19, about 17% of youth have stated that they have used marijuana before. Just along those lines, we know that roughly males and females are using about the same, and the frequent or daily users, though, it's more prevalent in males than females.
And is it going up or is it going down over time?
So that has been looked at, and while there's still significant numbers using now compared to recently, even back 5-6 years ago, there are fewer, the numbers actually have decreased rather than increased, which is a positive sign.
Okay, really good news. So it sounds as though our perception that the majority are using is not the case. It's in fact a minority of youth who are using, and that it is decreasing. How old are kids when they start using?
So again, this is fairly recent Ontario data, and when they studied that data, the initial group that they started with was in kids in grades 7 and 8, and already about 2% of kids in that age group have started to use. So that's important when we're talking to kids, knowing that we need to go down to the grade 7 to 8 range, and then numbers increase as things go on, as kids get older. So around 13% in grade 10, and then around 13% also in the grade 12, grade 13. Grade 11, grade 12 group are using or have used at that point, at that age group.
Okay. So it's sort of the fewer people at the younger age, and then the older they get, that's, okay.
Yeah. One of the just along the heavier, more frequent users, though, there's not too many that claim or state that they're using heavily in that sort of 7, 8, 9 age group that really gets into the 11, 12 age group. In Ontario, when they're asked the average age of start of use, it was just over 15 years of age was the typical age of onset of use.
Okay. And hearing about the age when people are starting will bring us, when a little later, we'll chat with Crystal about when to start talking to our kids about this. So we'll come to you. But first, youth are starting at a later age. Dr. King, why does that matter?
Thanks for asking me that, Amanda. First of all, I'd like to thank everybody for coming here. It's a beautiful building. I was explaining the first time I came to Kirkland Lake was 40 years ago when I was 17 and played hockey against your Fighting Irish and won most of the time. But adolescence is an interesting period of time. One of the things that we need to understand in looking at the potential impact on developing brains is some of the science behind the development of the brain. There's really 3 phases. So as most of you know, the brain begins to develop in utero after conception. In childhood, the brain starts to develop itself and responds to new experiences that the child's exposed to, and there's a beginning of a development of neural pathways being laid amongst the trillions of cells in the brain. In adolescence, there's a critical period of organization. So there's a couple of things to know. First of all, within our brains, there's an endocannabinoid system. So this is a series of cells that communicate with each other by neurochemicals, and the chemistry and the chemicals transfer information from one cell to the other through a gap in the cells called synapses. The chemicals in the brain are very similar to some of the constituents of marijuana. So most of us know that marijuana has a component called THC in it, and that's the thing that allows us to have a euphoric or intoxicating experience with marijuana. There's also another component called CBD, and probably hundreds of others that we've yet to fully understand in terms of the implications of using marijuana. When adolescents use marijuana, the constituents from the marijuana actually flood the system in the brain, which is developing the neural pathways. And the marijuana interferes with the development of the children or the adolescent's ability to develop pathways to alert the child to seek pleasure in a healthy and meaningful way. And instead, there's a pruning and sculpting process which strengthens the adolescent's interest in getting pleasure from an external substance like marijuana. So we're going to talk a little bit later about the implications of what happens to your brain in terms of academic performance, social performance, occupational performance, if you start to use marijuana on a regular basis early in life. So the age of onset is critically important.
So you mentioned just briefly the effects on the brain in different settings. I think a lot of us have heard that youth may say that cannabis helps them concentrate better, and that maybe they perform better in school when they've been using cannabis. Is that true? How does it affect their school performance?
Thank you. It's a good question. Many children and adolescents that we see at the Canadian Mental Health Association have attention deficit disorders or having difficulties with anxiety disorders or depression, and impaired concentration, a lack of self-worth, distractibility are really common. It's not uncommon for an individual going through their teenage years to say exactly that when they use marijuana, they feel better about themselves, they're better able to concentrate, and they feel that they perform better. Unfortunately, there's emerging evidence that the opposite is true in a minority of individuals. There's 4 studies now that have looked at the development of adolescents using heavy marijuana and their ability to perform in academic settings or vocational settings has been demonstrated to be compromised. So in terms of imaging studies, you're aware of what a CAT scan is. There's also imaging things called PET scans, which light up the part of the brain that's involved in completing a specific task when the individual is asked to do that. And what's been demonstrated is that adolescents who smoke or use marijuana in other ways in a heavy manner, and we'll define that later, have a decreased capacity to pay attention. They're actually more distractible, they're less able to problem solve, and they're less organized in general. And the summary of that is that the frontal part of their brains, which are involved in executive functioning, is actually compromised. So there have been structural imaging studies to demonstrate that, and there's subsequently been about 3 studies that have followed adolescents over a period of time. One study in particular in New England that has followed 1,000 individuals and divided them up into individuals who chose to use marijuana and those who did not. And there's emerging clear evidence that if you begin your consumption of marijuana early and you choose to use it on a regular or daily basis, there is decreased performance in high school. The rate of dropout in high school is probably 2 times the rate of not dropping out in adolescents who use marijuana on a regular basis. There's an impairment in social functioning, decreased satisfaction in social relationships, and unfortunately an increase in individuals who ultimately are not able to perform well vocationally and end up either on disability pensions or on unemployment insurance. So there is beginning emerging evidence that there are definitely negative consequences to choosing to use marijuana on a regular basis, particularly when you're young.
Thank you. Okay. So I bet it's not just at school that matters either. I'm going to come to you now, Crystal. You sit on the Road Safety Coalition. Is it safe to drive after using marijuana?
So that's a common misconception. So just as Dr. King mentioned, so using cannabis impairs your concentration, your coordination, your reaction time, and your ability to think and make decisions quickly. So all that together impairs your motor skills and your ability to drive. So short answer is no, it's not safe to drive after using. And we do know that studies have shown that driving after using cannabis increases your risk of a collision by 22%. And that when combined with alcohol, so a lot of times they are mixed, your impairment is even greater and your driving skills are even further reduced.
And what do we know about drug-impaired driving in the Timiskaming area?
So just as Dr. Cornel said, so as a smaller health unit, we don't have a lot of local data, but we can extrapolate from Ontario. And the latest Ontario studies are showing us that about 13% of youth admit to driving within an hour after using marijuana. So that is a startling fact. So they're more likely to be quite impaired at that point. And we know for grades 11 and 12, students just for comparison, for alcohol, that's 3 to 6%. So there is a difference. Thank you. And also nearly 20% of youth in the Northeast admit to being a passenger from a drug-impaired driver. So they don't have a safe ride home.
No, okay. And, you know, some people may recall when it seemed socially acceptable to get behind the wheel after you'd had a drink of alcohol, and now that's not the case. We've had a shift. Is that, how acceptable is it with marijuana? Is it frowned upon now?
Not really. It's a lot more normalized still. We have a lot of education to do that it is risky and it is dangerous. A Canada-wide study has suggested that a third of students and a quarter of parents don't see driving under the influence of cannabis to be nearly as risky as driving after drinking. And we also know with that in young fatally injured drivers, 60% of them are testing positive for marijuana. And so that's the second most common substance after alcohol.
Okay, thank you. Dr. King, what else does cannabis do to the brain? So for example, is there a link between marijuana and mental illness?
It's a really good question. Thank you. There is. It's difficult to research marijuana. Marijuana is termed a Schedule I drug in North America, which means that it's thought by the federal government to be potentially highly addictive and have multiple negative consequences on individuals' functioning. But given what we do know so far, there's an emerging sense that individuals who are genetically predisposed to schizophrenia, who then choose to use marijuana earlier in adolescence, likely will develop their illness earlier than they may have if they chose not to use marijuana. Amongst individuals who have a diagnosis of schizophrenia, and perhaps just to inform everybody, that is a psychotic disorder. It occurs about 1 in 100 times. It's characterized both by positive symptoms, which are hallucinations or delusions. A delusion is a fixed false belief that you can't be talked out of. And more importantly, perhaps, there are also negative symptoms. The negative symptoms include a lack of interest in pursuing things, so being amotivational, a lack of general interest in other activities in their lives, so being anhedonic, and alogia, which is a lack of verbal spontaneity. And I discuss that because there is a potential syndrome in marijuana. If you use it on a regular basis, you may become apathetic and amotivational, and sometimes it gets very difficult to distinguish that particular syndrome from the negative symptoms of schizophrenia. But if you do have schizophrenia and you choose to smoke marijuana, and up to 70% of individuals with schizophrenia do have a polysubstance abuse issue, the symptoms are typically more severe. There is less adherence to prescribed medication, which might otherwise stabilize some of the symptoms. So the prognosis, unfortunately, is much less than you would have expected otherwise. In terms of anxiety disorders and affective disorders, depression and bipolar disorder, again, we know that 6 to 7 people out of 10 with a bipolar disorder do choose typically to self-medicate with a substance, not uncommonly marijuana. But there is a growing sense that the prognosis is less favorable if you do choose to do that. There are a couple of studies that have looked at suicide rates, unfortunately, which are increased in individuals who use marijuana in conjunction with their bipolar disorder or their recurrent depressions. There is a group of individuals who have anxiety disorders and panic disorders, and you may have experienced this amongst your loved ones. Particular strains of marijuana are more likely to be calming than others. So there's a sativa group and an indica group. Indica marijuana is often relaxing and calming. Sativa strains are actually stimulating. So it's not uncommon for me to meet an adolescent who has smoked marijuana and has then experienced their first panic attack. So there's a correlation emerging between the use of particular strains of marijuana and the development of a panic disorder. So those are some of the emerging causal relationships.
With mental illness, thank you. Okay, so what about other health effects? Dr. Corneal, maybe to start, what are some of the most common ways that youth tend to consume cannabis? And for example, is it true that edibles are safer than smoking?
I think we have a slide on this one. So again, this has been studied just as recently as last year. And if you look up at the slide, that Most high school students are consuming either via the pipe bong route or the joint route, so inhalationally, and then about 10% are consuming with food. The issue with food is there's not as consistent a level of marijuana in the foods. So for youth or people who are looking for a quick fix or quick high, they can eat a brownie, not feel anything, eat another brownie, not feel anything, eat another brownie, and then run into trouble. So that's part of the issue with the edibles. But as you can see on the slide, most are doing it via inhalational methods.
And so you've spent a lot of time in Emerge. Have you ever actually seen someone overdose on marijuana?
So overdosing on marijuana basically doesn't happen. If it's a pure marijuana consumption, it doesn't, I don't believe there's any specific cases of overdosing on marijuana alone. Of course, there's a lot of polysubstance use, so marijuana being used with other drugs, so it can definitely be on board with overdosing. But we're seeing more and more cases of consequences of heavy use or side effects of use in Emerge for sure.
And we see that a lot of students are starting to use cannabis in the form of vaping. Is it safe?
Yeah, so vaping's an interesting one. Certainly anecdotally, locally at the high schools, there's more and more visualization of teens vaping. The concern is with respect to THC. So one of the points that, because I'm thinking of it, we'll make now is modern marijuana is not the marijuana of the 80s or even marijuana of the 60s. There's a much higher concentration of THC in marijuana. And this is part of the problem with vaping as well, is vaping and vaporizing is the purpose, or one of the reasons behind it, is to increase the level of THC in what is being consumed. So that's part of the problem with vaping, is you're already using a product that has higher levels of THC, and you're using it in a form that even more so increases the level of THC in what is being inhaled. There's also, with vaping, it's easier to hide, so you'll see teens with it hidden in their coats. There's less odor, there's less fumes with it, and there's unfortunately a bit of a hip factor with vaping as well. So while the numbers are quoted in this study, it was only a year ago of around 6 to 7%, the feeling is that is in fact increasing.
And so what about other health effects? So is cannabis going to affect lung cancer rates, COPD? What other things are you starting to see? Yeah, so with majority of being inhalational, inhaling cannabis is a risk factor for COPD, or chronic obstructive lung disease, but specifically the chronic bronchitis form more so than emphysema. So chronic bronchitis is irritation of the upper airways, which leads to a chronic cough, chronic spit, chronic mucus production. So it is a risk factor for COPD in that sense. With respect to lung cancer, it's attempted to be studied, but it's hard to separate it from cigarette smoking. For a lot of people who are smoking marijuana are also cigarette smokers, so it's hard to find a population of just marijuana smokers to see. So right now, the quick and easy answer is we don't know if marijuana is linked or is causing lung cancer. With respect to other medical issues, part of the risk of marijuana is when it's on board, decision-making changes. So we talked about car accidents and impaired driving, but also making bad decisions with respect to the amount of alcohol you drink, the other drugs you use, sexually transmitted, unsafe sex practices is being linked with that as well. One other, just going back to the Emerge question, one of the things that we really see today, which we really never saw before, is this hyper-excessive vomiting syndrome, or hyperemesis cannabinoid syndrome. And this is really a significant thing that we're seeing in Emerge. So I've been in Emerge for about 20 years now, and early on in career, this is something we never saw. And especially over the last 5 years, again related to how much THC is being consumed and is in modern marijuana. This is a syndrome that we're seeing in Emerge, often with young adults. And what it is, as Dr. King talked about with receptors in the brain,
while low levels of marijuana can be an anti-nauseant and help with nausea, when you flood the brain with THC, those receptors are overwhelmed, and with chronic daily use, it can induce this hypervomiting state. And it's an interesting one because all the usual things that we use, like Gravol and Zofran, doesn't work for this condition. The only treatments are hot baths, hot showers, and then other psychoactive drugs like Haldol or haloperidol, which we use for psychotic disorders, and then medications like Valium. And the big message, if you come across or if you know somebody who has this hypervomiting syndrome, is the only treatment is to abstain from marijuana. And there's this perception that marijuana is good for nausea. How can it be making me vomit? It must be something else going on. But it really is linked to cannabis use, and quitting is the only cure. And it's not just vomiting that these people present with. They're getting admitted to hospital. They're a lot of abdominal pain. They're undergoing many investigations trying to figure out what's going on. And more we're realizing that it's in fact just way too much cannabis use.
Okay. So you mentioned, marijuana is supposed to be good for some things. So we're hearing about marijuana being harmful, but we also know that it's being used for medical purposes. So how do we reconcile that? Would either of you like to comment on, is it good, is it bad? Are we giving mixed messages to you?
Well, it's a really good point. One of the things I think Wanda stressed today is that there's really a spectrum in terms of the use of marijuana. Many individuals do use marijuana socially and do not develop a problem. Other individuals use it in a problematic way, particularly if they start in early adolescence and it begins to have negative consequences, both socially and educationally, and then vocationally. And then a very small group of people do develop a clear episode or condition which demonstrates that they've become tolerant to the doses that they're using, they're developing withdrawal symptoms when they're not using them, and they fulfill criteria for an addiction. On the other hand, there are multiple studies that are just beginning now that have been designed to identify some of the positive benefits of marijuana if it's used in a well-informed and educated and supervised manner. And that's just very beginning, but there are studies regarding post-traumatic stress disorder, there's studies looking at its use in autism, studies looking at its use in seizure disorders, chronic pain control, in a number of other situations, fibromyalgia, for example. So there is a spectrum, and there are potential benefits, and there are also potential negative consequences.
I think the other point to make with respect to, this isn't about medical marijuana, but the two main components of marijuana, as we talked about earlier, are THC and CBD, and it's that CBD component that a lot of the medical marijuana benefits and anti-inflammatory benefits, perhaps, it seems to be more CBD and much less of the THC, which is the more the psychoactive component of things. So a lot of medical marijuana also is focusing on oils instead of inhalation to try to prevent the damage to the lungs.
Yeah, okay, thank you. Dr. King, you mentioned briefly that spectrum and the addiction end of it. So why don't we talk about that for a moment now? We hear sometimes that marijuana is considered a gateway drug. So does using marijuana increase the risk of using other drugs?
You've probably heard that term, it being a gateway drug, was something that was developed in the early 1970s. It's probably not a really healthy message to provide to adolescents that are making important decisions about whether or not they're going to use it. Marijuana itself is probably not a gateway drug. The more important thing is if you use something that's psychoactive in your early teenage years, there is an alteration in the endocannabinoid system that I was talking about in the brain, and the brain learns and reinforces the pathways which allow then the continuation of behaviors to get pleasure from substances. So any substance which begins in early adolescence increases the risk of using alternative substances when you're older. The bottom line is if you use a lot of marijuana in early adolescence, you are at very high risk of using alternative substances which have a detrimental effect on your health when you're older. If you choose to use marijuana in adulthood, it does not. There's no clear evidence that that then leads as a gateway to the use of alternative drugs. The other thing that we've talked about is, as opposed to being a gateway drug, there's early evidence that it may be an exit drug. So most of you have heard about the fact that there's an opioid epidemic right now, particularly with the use of fentanyl and thousands of tragic deaths. And there's an emerging sense that marijuana may have a place in a part of a harm reduction process where individuals who are addicted to an opioid are actually prescribed marijuana. And there are anecdotal reports emerging that has been very helpful in some individuals' lives in reducing their dependency on an opioid and using marijuana in a safe and regulated manner.
So why do young people use marijuana?
It's a good question. It's really important to include that in your dialogue with either adolescents that you support or teach or you love. Many different reasons. The young adults that we see at the CMHA and Nolisker tell us that they often use it because they're bored. They tell us that there isn't enough structure in their life, there aren't enough things to do. I hear that often. I see many examples of wonderful things to do in the Timiskaming Shores area, but not necessarily so from the perception of a 14 or 15-year-old. 14 and 50-year-olds with anxiety disorders, eating disorders, depression, are looking for a sense of identity. They want to belong to something. They're very isolated, and they may gravitate towards a social group who is actively using marijuana. The myths are very prevalent. When I speak to individuals and ask them if they use any non-prescribed substances, the routine answer is no. I just use marijuana. So the perception is it's not included in a drug that might potentially have negative consequences in their life. And they also use it to self-medicate. So it's not uncommon for a child who isolates and is playing video games and is not able because of a depression or an anxiety disorder or an impaired sense of self-confidence for many reasons to join the social group, but they are using marijuana on their own in an isolated manner, typically playing video games and attempting to feel better through doing that. So multiple different reasons.
I suspect that this is more of some of what we'll come back to when we talk to Crystal in a few minutes. Not yet. So can you describe some of the signs that a teen might be using cannabis?
Sure. I facetiously said none is probably the answer. I think many parents are very surprised that their children have been using marijuana for a significant period of time before they become aware of it. And often there's a sense of guilt or parents being very self-critical for not being able to identify that earlier. But not uncommonly, there is a change in their academic status and their capacity to perform at school, so marks start to drop. Truancy is something that sometimes happens. A switch in the social group and the peers that they choose to be with is often an early indicator. There's often some personality changes, so if they're smoking marijuana excessively and then they don't have access to it, there can be the emergence of symptoms of withdrawal. So the children are more irritable, they're more angry, they may be losing weight, a decrease in their appetite, and sort of a cycle that follows in that way. And I think it's really important to recognize that there are various ways of using marijuana. It used to be that we would look for bongs and roach clips, so you should have, or it would be helpful if you had an understanding of what type of drug paraphernalia is used. But as Dr. Cornell said, there are multiple other ways of using marijuana at the present time, and so that's less of an easy way to identify that concern in an adolescent than perhaps it used to be.
That's making me think of when I used to go to the Midway and get the roach clips and put them in our hair, because we were 12 and that's what we thought they were for. Okay, this is a great, so why don't we talk to Crystal now? So Crystal, we've heard about the effects. We've heard that we want young people to not use, or at least delay using into their 20s. because of the developing brain. So what does that prevention or delay even look like? Does it work?
Well, it does work. I will show you. And here we go. So the answer is simple, but it's a little bit complicated. So the oxymoron. So many of us have heard of resiliency, and so if you haven't, resiliency is defined as the ability to bounce back from life's adverse events. So that you have healthy coping mechanisms and you can move on. But how do you develop resiliency in someone? So the developmental assets are a little bit more of an American language, but they really go hand in hand with resiliency. And so the Search Institute has kind of coined them and researched these developmental assets over the last 20 years. So they've come up with 40 that they've researched. And so their results show that doesn't matter your gender, your ethnic origin, your geography, or your income, that these developmental assets are really universal across all young people. So they're the building blocks of healthy development. And the good news is the more that you have, the more likely you are to thrive. And the fewer assets that you have, the more likely you are to be involved in more risky behaviors. So the great news for us is that anyone can be an asset builder. So whether you're a parent or a coach or a teacher or just a neighbor, you can have a positive influence in a young person's life. So I said there was 40, and that's really daunting, so we're going to go over them a little bit. So there's internal and external, and so internal assets are ones that a young person has and develops internally, whereas external ones are just that, they're external, and so those are the ones that you guys can help them build. And so there's 4, and so quickly we're going to go over them. So support. So a young person needs to feel loved and supported by their family and have open communication with them, and that they look to their parents for advice. Other adult relationships, so that the key number is about 3, they say, other non-parent adults to have in their life that they can go to for advice and support. So whether that's a teacher, or an aunt and uncle, or a caring neighbor, grandma, grandpa. And that they should have a caring neighborhood and a caring school climate, and they feel like they belong, and that parents are involved in school, not so much that they're doing their homework, but they actually take an active interest in what they're learning. Empowerment, so that the community sees youth as a resource and not as using up resources, and as we mentioned before, that they have a sense of belonging. So if they volunteer, they feel more likely as part of a community, and that they belong to a group, and that they feel safe at home, at school, and in their community. And boundaries and expectations, so that school, their neighborhood, and their family have boundaries and expectations that young person knows and follows. And that they have adult role models in their life who model healthy behaviors. So if you yourself are using substances, what kind of picture are you showing for your youth? So it's always good to have that check of how you're coping yourself. And positive peer influence, so if their friends are more likely to use, they are as well. So that's where you can come in as that other caring adult, so get to know your child's friends and then their parents as well. And having high expectations, not so much that you're stressing them out, but that you do want to see them succeed. And constructive use of time, so one of the reasons that they start to use is because they're bored. But if they have a passion, or they can do things with that excess time, that's really one of the protective factors. So whether they're involved in sports, organized or unorganized, arts such as dance, theater, gymnastics, those things eat up their time in a positive way, and spending time at home with your family is a good protective factor. So those are things that we can do as ourselves and as a community and as a society. So just a quick example here from Iceland. So yes, prevention actually does work. So Iceland has been making waves lately, as they're a country who went from having the highest substance use rates in all of Europe to having the lowest in 20 years. So prevention is a long-standing thing, and so an ounce of prevention is worth a pound of cure. that I got that wrong, but you know what I mean. So Iceland has targeted behavior change and not just attitude change. They created more supportive environments so that substance use wasn't so normalized, so teens are not out at dark being drunk in the streets. And they really worked on strengthening the parent-child relationship and getting kids involved in extracurricular activities. So this is just the graph of their usage rates. So again, they really focused on these things, the protective factors, which we've just went over as developmental assets. You recognize them. And so there are 3 pillars of success are evidence-based model, community-based approach, and an open dialogue between all partners involved. So on evidence and dialogue, so students are surveyed actually every single year because the life of a teen changes quickly, and so that's where the open dialogue comes in, that they share these results locally with every community, so all partners involved, so government, healthcare, parent organizations, NGOs, they all know what's going on, and so they can react quickly to those changes. So as a community approach, Iceland really tried to work with local communities. So what works in Toronto doesn't necessarily work here. So taking that local approach to community. And they really tried to strengthen the parent organizations, supporting active non-government organization and co-ops that work towards reducing drug use, as well as really bumping up the extracurricular activities that were available. And as a government, you'll see a lot of these are actually already in place in Ontario. So age restrictions, advertising bans and such. And they've also implemented a curfew. So it's actually illegal for teens to be out past 10 or midnight in summertime. So, and they actually are abiding. And so as a result, they've seen drug use go down quite dramatically. And as a spin-off to that, youth are being more involved in sports. There is an increase in that family tie. And when youth are out of the house, parental monitoring is there, so they do know where their children are. And also as a side to that, so with being prevention, they have fewer needs for social supports later on in life, and they're seeing actually safer cities too.
That's wonderful to see that there are world examples that we can learn from and take pieces from in our community work. And there are a number of people in the room here who do that sort of community work, so that's really wonderful. So we've heard about the importance of talking to our kids at an early age and so on. Can you talk a little bit about how do we do that? How do we have that conversation? What does that look like?
All right. So a lot of you in the audience do this, but it's very open, it's very positive to have open dialogue. So to start early and talk often about it. So we've just heard they started about roughly 15. So it's not too early to start earlier than that. You're not giving them the idea to use. So to stay connected and have that relationship where it's not just out of the blue that you're talking, to keep those lines of communication open and to be positive, to focus on safety, so show that you're actually concerned, to be informed. So yes, you should know the facts that you're going to tell them, but don't assume that you know it all. You might learn a thing or two from them as well. To be supportive and try to find those passions that they have to get them into those extracurricular activities, and then to be a healthy example yourself. So a lot of times you might get shut down. So trying to be non-judgmental is very important, and then to stay open with that conversation. We do have some resources at the back that were really helpful with that as well. And one of the tips is to never start with an accusation. So don't ever start with, do you do drugs? So try to feel it out a little bit more before that. Don't lecture them.
Yeah, okay, thank you. We're nearing the end of our panel portion, so if there are questions that the audience has that you'd like to ask of our panelists, I invite you to come up. I know we're in a small room, but so that our viewers can enjoy the questions as well, I will ask you to use the microphone if you don't mind, or if you ask it, we'll repeat your question so everybody hears it. So you can start thinking about that. But first, is there anything that hasn't been covered that any of you would like to add?
I think it's important with the legalization question coming. The question is, with legalization, are kids more likely to use? And there is some studies and evidence on that. I think we have a slide on that. So again, this was asked last year, and the good news, I think, from this slide is, again, most youth are not using, so that's the top bar, is that they're not using and not planning to use anyway. But if you go down to the second last one, 4% talk about, only 4% talk about using it more often if cannabis is legalized. So obviously once legalization takes place, we'll have to see where those numbers go, but it looks like when youth are asked that it's more these other things that Dr. King was talking about earlier with respect to what are the peers doing, what are the social components of things, what's going on in their life, more so than legalization. Obviously we'll have to see, but that was an encouraging study.
Right, yeah, thanks. Anyone else? Anything else that you'd like to add that we haven't touched upon before we go to questions?
I don't think so. I'd love to answer some questions.
Questions? Do we have questions in the room? I'm going to check our online feed and see if we have questions as well. Anyone? Do you want to, we have a question online actually. If you could take a moment, we chatted briefly about that spectrum of use, maybe to go into a little bit more detail and describe what those different stages look like, from regular substance use, problematic use, and the addiction. Would you like to take a moment to do that?
Sure, yeah, I could do that. Yeah, I think it's important to inform ourselves that the vast majority of individuals, either adolescents or adults, who use marijuana are able to use it on a social basis. And many of the individuals that I support or meet who use marijuana actually choose not to use alcohol. So it's an informed choice to use a particular substance in a social manner and does not lead to any impairment in their social relationships or their workplace or a negative interface with the law. A small percentage of people do develop problematic behaviors. Oftentimes that's an indication that there are a number of other issues in their life that they're beginning to identify, and which you can assist them in identifying and supporting. And sometimes the emergence of problematic use of marijuana, we actually create a healthy opportunity for families and individuals in the supporting and healing professions to assist an individual in identifying the root cause. There's a family doctor whose name is Gabor Mate, some of you may have read some of his work, who talks about trauma as being the root of addictions. And so sometimes there's an uncovering of that and a beginning of a healing process. And then a small group of individuals do definitely become dependent upon the substance. And there are really four categories there. One is the emergence of a true impairment in their social functioning, a change in their relationships with other individuals, the development of risky behavior, beginning to go to places where they wouldn't otherwise go, beginning to spend money excessively. So talking to individuals, if they smoke to 1 to 3 grams per day on a daily basis, they're now spending $300 to $400 per month, and that has a negative impact on many other aspects of their life. And then beginning to develop tolerance, so the increased need for more and more marijuana to acquire the same subjective response that they initially got in the emergence of dependence in the form of a withdrawal syndrome, where they're actually physically ill if they're not able to continue to access the amount of marijuana that they have been used to.
Yeah, okay.
I think there was just, maybe Walter, there was a slide that was, I think I forgot to mention earlier on when they looked at how much are youth using, and if we get it back up. So when they studied in the 15 to 19 age group, almost 88% weren't using or hadn't used within the last 30 days. But when you get down to the bottom part of that graph, you're seeing the number of people who are, or young people who are using 1 to 2 times a week, 3 to 6 times a week, and daily. And we've talked a little bit about alcohol, we've got sort of guidelines, if you drink more than X number of drinks a week, if you're a woman, if you're a man, we have a little bit more guidelines on that with alcohol, but with marijuana, we don't really, I don't think, have specific guidelines of, you really need to stay below this level to not damage the developing brain. I don't think we really have a number, right, as to what not to try to cross as a way of a threshold with respect to doing the damage to the young brain.
Yeah, no, you're absolutely right. And I suppose one of the positive outcomes of legalization is that there are going to be standards which the medical marijuana licensed producers are going to develop. Right now, when you buy marijuana, there's a lack of understanding often of how much THC is in whatever you're using, how much CBD is, what particular strain is that. So I think there's now an opportunity to have a better sense if people are making informed decisions, then the research will follow and begin to answer questions like that.
And I think the other point with that is when youth are using street marijuana, you don't know what else is in it. It's often cut with other things. Just going back to that hypervomiting syndrome, there was a study, I think it was in England, where 25% of the people who were getting into hypervomiting actually had levels of lead that qualified as lead poisoning. And again, lead was being added to the marijuana to make it heavier so you could sell more of it. And so maybe there's a component of that. There's also heavy pesticide use for a lot of people. So a lot of the marijuana that's out on the street, there's mold issues. So it's not just marijuana, it's the other things that go along with it too.
Yeah, thank you. Any questions?
Just a clinical question about hypervomiting. Does that happen in adults as well?
So it can happen in anybody. We're really tending to see it in the young adults. So we can see it in teens, but not as typically, because you generally have to have been a fairly heavy user for a longer period of time. And what we know, so that is the population that we're tending to see is the young adults, early 20s. I think that's the, if I go through my head, the people who we tend to see with this are admitting or frequently presenting with this, that's the age group it tends to hit. I think it can be any age group as long as you're heavy, prolonged use, and it's that saturating of the receptors. And we also know that where the receptors are in the brain is related to the stress centers as well. So this hypervomiting syndrome tends to be triggered by periods of stress as well. So it's an interesting syndrome.
Mm-hmm. Other questions? Yeah. I'll repeat your question once you've asked it.
What kind of presentation are you doing to the youth?
The question is, what kind of presentation are we doing to the youth? That's a good question. Crystal, do you want to try to, well, actually, I'll speak to what I understand the schools are doing. I've heard pieces about the school boards and the Ministry of Education being very, very forthright. We've already, there's some resources that are, thing that I dropped earlier, coming out from the schools that are really excellent. We have a number of copies of these on the table for schools to receive, to help parents and teachers know how to talk to kids. I don't know, actually, Carrie, who's here in the room, maybe if you want to go to the mic and share a little bit about what you know is happening in the schools would be helpful.
Sure. So there certainly is information covered in the curriculum. So I think that's really important to have to make sure that that's happening. And there's a lot of work being done sort of in that tiered approach around promoting mental health and self-esteem and those social connections, having caring adults in their lives universally for everyone. And then we're looking at, we also have a school health team at the health unit, a team that we're looking to work with the schools to support them in this. having youth talk to youth. There's some work happening right now in developing material, youth-facing material by youth for youth to talk about this. And also skill building. So education isn't always enough, but social skills, behavior, how to be able to say no and make those decisions and informed decisions. So I think we're going to see more of this. Certainly, it is very important to have, and we're certainly keen to work with our partners in education on that.
I think there's a lot of dialogue going out in the province, across the country, and one of the messages that we hear repeatedly is don't preach to the kids. They don't want to be told. They want to be informed. So these sort of discussions, talking about the impact on the brain, talking about the frequency of use and how it's not a benign drug, how it is getting the word out about with respect to driving. That's sort of an underlying theme that we're frequently hearing is, and even just with this forum coming, just I talked to a number of friends of who have teens, and already the kids are asking the questions. They're coming up to their parents with concrete, interesting questions about the substance.
Yeah, that's great. I actually have a question. If we're wanting to talk to our kids and we want to understand, or we think our kids might be using, and we're not going to say, "Are you using drugs?" What's the best way to understand, or to ask that, to understand how much they may be using? Do you have any tips?
I think really it's just about open dialogue and not judging, and so just keeping those doors open and knowing that they can come to you for advice, and so that is really step one. And so just talking early and often is really to get.
And if I want to know quantities, I don't know how to talk about that.
We talked a little bit about that last night. It's really variable. We should just ask, how many joints do you smoke? But as you probably know, there's now multiple methods to ingest marijuana. The way that I sometimes talk about it clinically, my boys are 33 and 31, but with an adolescent, I sometimes ask them about money. If you're making this informed decision, how much is that costing you? And we have a discussion about what it costs in their particular community to buy a gram of marijuana, and we begin to add it up, and then I ask them not to necessarily look at the negative implications of ingesting the substance, but how is this affecting other aspects of your life? If you're spending $400 a month on this particular substance, what are you losing out on? What are your dreams and your goals, and how are you going to get there if you have a summer job making $600 a month, but you're spending $400 on marijuana? And non-judgmentally, but that's sort of a fact. So do you want to have a discussion about that?
And I think that can extend to school performance too, depending on what their goals are. And it's reminding them that if you use on a Thursday night and you've got a test or an exam on the Friday, it's still, your brain is still being affected by the use the night before. And we know with where it's impacting the brain that it impacts on school performance in a negative way.
Yeah, thanks. Other questions from the audience at all?
We talked a bit about long-term effects, but if I understand correctly, especially in the preteens and the younger teenagers, a one-time smoking a joint can create enough chemical imbalance to create long-term effects. And put them into more of a depressive state. Is that right?
I'll repeat the question, if that's okay. So the question is about long-term effects and whether even one-time use can actually lead to a long-term consequence. And Dr. King, you were going to answer?
That's a really good question. Most of the kids that I talk to are very informed about marijuana. They would object to that. But one of the things that Dr. Cornell said was, if you buy marijuana off the street from a source that you don't know. I used to work in Southern Ontario, and I treated people from the Hells Angels and organized crime. They routinely cut their marijuana with fentanyl, sometimes with crystal methamphetamine. So a one-time use of that particular combination could result in an overdose, seizures, a potential lethal outcome. With marijuana itself, I don't believe that there's any research suggesting that that would then have long-term structural or chemical changes in your brain.
I know that historically, I've heard of the term first episode psychosis, which can sometimes be brought on by marijuana use. And I guess for me, that's how, like, I kind of see it, that one particular time you're using marijuana, it's like something, it could give you that first episode of psychosis.
You're exactly right, and I think that's probably what we missed for a while. A lot of people argued, well, marijuana couldn't possibly do that, so the individual must have schizophrenia, but sometimes individuals who are psychotic, they respond, as you probably know, within 3 to 5 to 7 days in a hospital setting with a small dose of an antipsychotic medication, and that shouldn't happen in schizophrenia. Schizophrenia is much more challenging to treat than that, so that's a diagnostic clue that, yeah, there was a cardinal event that precipitated the psychosis, but it was likely not marijuana. It was probably marijuana in combination with something else that the individual either knew or didn't know was there. So you're absolutely right.
Yes?
It's more around sleep, so clinically, that I can send over to you, but also I'm a parent of a 13-year-old. So teenagers notoriously are not good sleepers in terms of the way adults want them to sleep, want to get on time, that kind of stuff. There's lots of research around why that is in that school, but some kids, I think, are using it to fall asleep or to calm themselves after video gaming and different things to get to sleep. One, how can we talk to them maybe about why that's not a good idea? Maybe Crystal, maybe I can answer that. But secondly, are the kids being informed of, within the education around sleep? Why is it important? How does cannabis or alcohol or other drugs impair good sleep and kind of what that means for them? So a lot of times I'm hearing something and then I meet this on the street and stuff. Well, do you use it to fall asleep? So is it, alcohol is not great for you to sleep. Is that true cannabis? I'm actually not sure. And then how do we communicate with or feel around that?
So it's a two-part question I'll repeat for our sizable online audience, about whether cannabis is effective in helping youth fall asleep, understanding that some youth may be using it to help them fall asleep. Does it work? Is that true? And how do we talk to them about that? And a question too about what do we know kids are being taught around that? Is that being discussed, and what are they being taught around sleep?
It's a really good question. And a lot of young adults and adolescents are really well informed and do believe they're making well-informed decisions. They use a particular strain during the day to be activating and then an alternative strain at night to get to sleep. One of the challenges is that in a developing brain, the kids that I talk to say really high percents of THC, so 20, 24, 20%, that's what allows them to get to sleep. So it's a really challenging argument to talk them out of the fact that they do get a restorative sleep. I'm not aware that there are any significant sleep studies. It would be very helpful if there was. You're very right, alcohol interferes with REM sleep, the restorative sleep. I don't know, and I don't think anybody knows that about marijuana yet. But, the dialogue might go back to why is it a challenge for you not to sleep in the first place? What's the underlying issue or issues that's contributing to that? Are there alternatives? We can talk about sleep hygiene, discuss melatonin, things like that. But I have trouble sometimes because some of the potential benefits of marijuana are real. And the kids are well informed and they're making educated decisions. And sometimes it's, for me, it's an acceptance of that if they're willing also to go on and look at some of the core issues in their life that are truly contributing to their sleep pattern being perpetually not very good.
And then I think you're getting, just in general sleep hygiene, if you're having to use anything frequently it's very hard to get off it, and then if you're using more and more marijuana to help you with sleep, then we're getting back to the brain development and the longer term impacts on the frequency of the use. Just we've talked a lot about sort of modern marijuana and the THC level. So we're seeing modern THC levels being in the 22%. If you go back to the 60s, if I understand correctly, THC concentration was about 8%. In the 80s it was about 12%. I think something along those lines. Is that?
Yeah, one of the figures, a joint today was equal to 17 joints in the mid-1960s, just to get a visualization of that.
Yeah.
I have another question follow-up on that, actually. Is the medical community on board with maybe helping our youth get insurance of, is there something else they can give or is that equally as bad? If you want to get off the weed and then you're saying, I can't sleep without it and I'm not willing to just do this whole turkey because it's a lot of people aren't.
Yep.
Is there something that they maybe need to take them down or give them something else in terms of help them with some education or getting off that too, or is this all just not good?
Yeah, I think, sorry, repeat, did you want to? Just we're talking about, sleep and what resources are there for helping kids if they are frequent users of marijuana to help with sleep. What can we do with that? I will say in 20 years I've never had a kid approach me about that. Whether it's just they're not comfortable or whether they're just, again, along the lines of self-medicating. We are seeing more young people coming to the office looking for medical marijuana to replace what they're using off the street. And so sometimes there can be some dialogue along those lines. You can help them convert off the THC and and maybe use some of the CBD side of things for medicinal benefits. But we really try to get anybody off nightly things for sleep if possible, but we also talked about maybe trying to convert over to melatonin or something safer and more natural, perhaps along those lines. But also again address how did you get up to these levels, making sure they realize the harm of what they're doing with respect to frequent and nightly marijuana. And then and how many of this population is just using it for sleep, right? Or is it they're using it a lot socially, they're using it for other things, and then they learn that it's I'm having trouble falling asleep unless I use, and so it's often just not an isolated sleep thing, I think. But if that answers your question.
Other questions? No?
I'm just going to mention a little bit. We talked a little bit just about pregnancy. Youth pregnancy and marijuana is I think something that we as a community need to do a better job of talking about. Dr. King mentioned earlier about the brain development starts in utero. We talked last night about marijuana is a substance that is what we call lipophilic. It does cross the placenta barrier. It does cross into the brain. It is a harmful substance in pregnancy, and I don't know if that message is getting out enough because of the thought that marijuana is not that harmful. Marijuana is not as harmful as alcohol, and in pregnancy it's not good. And I know as a practitioner, if I have somebody come in and says, I'm using Percocet in pregnancy, we get into neofax, we get into addiction centers, we get them very important to get them off, and I think we need to help the teen moms or the young moms or any mom that are on marijuana being aware of how important this is. And again, that message starts before they're pregnant, and I think it's something that we maybe need to emphasize as there's more and more discussion about marijuana is the potential harm in pregnancy. Did you want to talk a little bit?
Well, we do know a fair amount about that. Marijuana regular use decreases sperm counts in males. It increases the likelihood of a miscarriage. There's an increase in ectopic pregnancies. It does pass through the placenta. There are 3 long-term studies now that have demonstrated that the children are often underweight when they're born. There's 2 prospective studies from Europe that have suggested that children who are exposed to marijuana in utero actually are not doing well in terms of academic performance compared to another cohort that wasn't exposed. And something that the kids sometimes respond to is that if you expose a fetus to marijuana, the effects that you see in a fetal alcohol spectrum disorder, and they've been exposed to that concept in the high schools, are doubled or tripled in terms of their negative effects. So there's a synergistic negative impact on the fetus. And there's also a very strong caution not to breastfeed if you're choosing to use marijuana, and there's a counter argument on YouTube and so forth. There's actually a group in the United States that promotes the use of marijuana during breastfeeding, and so they're going to bring that forward to you, but there's some scientific evidence that is not in the best interests of the baby.
Yeah, thank you. Well, as we start to wrap up, I wonder if each of you would maybe like to take a moment to think about what your bottom line might be after tonight. What are the takeaways that you'd like everybody to have after this discussion?
Yeah, I think from my end of things, I think things that I've learned too in preparing is being aware and underlining how much THC is in modern marijuana, that the marijuana today is not the marijuana of the 80s and the 60s. I think that's a really important message. And then along those lines is the frequent users and in the young adult group, and what that is doing to the developing brain. I think kids are looking to be informed and informed choices, and I think those are a couple of messages that are important to underline with them and during the discussion.
Yeah, thanks. Dr. Kane?
Well, in my clinical work, it's sort of been a blessing to begin to see this process unfold. And I was saying last night, I'm not sure that I know of another situation where I have learned more from the patients and the clients that I support, sitting and listening to a 16 to 17, 18-year-old who is maybe more informed than I am regarding marijuana. It's been a really positive learning experience. And if I am non-judgmental, which I attempt to do, often we can develop an alliance, and it is not uncommon for the individual that I'm talking to say, this is not best. I do not want to spend that kind of money. I do not want to jeopardize my health necessarily. Is there an alternative way that I can get the same effects, either through a body stream clinic or a medical marijuana clinic or an alternative? And then we get into a discussion about THC versus CBD. So I would just encourage you to be aware of the potential negative effects, but the emerging potential opportunity for some individuals to use this substance in a very positive way in their life.
And I think for me, my take-home message would be that don't underestimate the power of your influence. Prevention does start at home, and to help support them and find their passion and to use up that time constructively. And to drive safe.
And drive safe. And then the other point that I think I've heard before too is the delay.
Yes, and to delay your use, right? So our message is not don't use, but be an informed person, and then if you choose to use, do so later in life.
Yeah. Well, please join me in thanking all of our panelists for sharing all your expertise this evening. Thank all of you for coming and asking your questions. I hope that as communities we can keep this conversation going as all of the context continues to change. I think we'll have a lot of opportunities to talk about this and continue to see about bringing those low rates even lower, continuing to support our young people and being healthy. So thanks very much, everybody, and thank all of you for coming.
Thank you.